Now, with the standardization, we are currently living in the age of CBME, right? Competency-based medical education. Competency-based medical education. Now, we are looking at competencies. We are expecting our students to fulfill these competencies, but are they really doing it? How can this standardization of medical education, has it really been successful in elevating the standard of medical education? Now, we have got a lot of modalities. We have got lectures, we have got a lot of learning resources, but the student still remains confused to some extent. Now, that was what we were trying to, that issue we were trying to actually solve with the use of technology. Now, actually written here are some of the main constraints of the current medical education curriculum. We have got outdated content. Me being a physiologist, I can always vouch for this outdated content because, again, this might be an unpopular opinion, but my personal one, we have got practicals like hematology practicals, where we are always trying to make the student do certain outdated methods of estimation of various blood parameters. Now, it is high time that this needs to be replaced by something that is much more contemporary. Now, outdated curriculum is not just a single issue. We also have limited exposure to patients, right? Now, medical education always was taught at the bedside. But in today's day and age, medical education is taught at the bedside, but the problem is it's at the student's bedside rather than the patient's bedside. Now, limited exposure, patient exposure is again one of the issues that we will try to solve with the help of artificial intelligence. Another thing is faculty shortages, which we were having quite a healthy discussion on faculty shortages with Vinu sir also. So this is something that is plaguing a lot of medical colleges, right? Even with the outdated curriculum, even with limited exposure, if we do not have the human resources that are necessary to implement them, then again medical education goes for a toss. Which is why statistics has shown that only 15 to 30% of fresh pass outs of MBBS, only they are confident in making a proper diagnosis. Others are just not able to do that. Now, this is where technology came in. So, especially since the last few decades, technology, digital learning has come into the foray. People like this guy with the obnoxious YouTube channel. So, digital learning, e-learning platforms, e-books, everything has been coming into the forefront to address various defects in medical education. But even then, this was not helpful because after a while, the student involvement was actually missing with such resources. Now, enter simulation. So, this is where technology is currently heading into, and simulation, even National Medical Council has been putting much more emphasis on simulation. NMC wants every medical college to have a simulation center with some prerequisites. But then again, one of the main problems with simulations is the prohibitive cost. We are living in the age of SimMan 3G+, which is a high fidelity mannequin, often running into 3 crores in expense. Of course, it can actually bleed when touched, it can simulate seizures, it can shed tears. But then again, this limits the SimMan or the high fidelity simulations into a Apex center, and it is not easily available to the students and other faculties. Now, this is where AI has come into the forefront, right? Artificial intelligence. What exactly is artificial intelligence? Now, to answer that question, we need to pause everything and maybe introspect ourselves. What exactly is intelligence? Only if you know what is intelligence can we make it artificial. So, what is your opinion on intelligence? Are we intelligent? Has anyone stopped in life and asked yourself, am I really intelligent? So, if you were to assign a sentence to intelligence, what would that be? What exactly is intelligence? Anyone? Dr. Vishnu? Anyone? Are you intelligent? Yes. Now, human race as such, we take great pride in being intelligent, right? But what exactly is intelligence? Now, if I were to put it simply into a few terms, intelligence is the ability to learn and apply. To learn what? You have got information, right? Tremendous amounts of information. You are collecting that information, you are processing information, you are analyzing information, and then you use that information, convert it into knowledge, which you are retrieving to be used where it matters, at the right place, at the right time. This is intelligence. And I would go to such an extent to say that intelligence is the superpower that makes us humans the dominant species in this planet. Would you agree with me? Yes. How come? Of course, we being from the medical background, we know that human beings, they have got a higher cerebral cortex to body ratio. We have got larger prefrontal and frontal cortex. We have got more gyri and sulci, so that we can cram in information wherever necessary. But is that the only reason why human beings are the dominant species? It's because humans, we are not just individually intelligent, we have something known as a collective intelligence. Now, right from 20,000 to 30,000 years ago, when humans started evolving beyond the basic needs of like food and shelter, they made it a point that they collect whatever information that they can see around them and store that information. Right. We have got the Ishango bone, which was discovered 20,000 years ago, a bone of an animal marked with the counts of the number of kills that person made. That is information that was being stored there. And then as time progressed, this information became stored in pamphlets, in paper scriptures, then it became books, libraries, floppy disk, CD, then it became hard disk, and now we are all living in the age of the cloud. Everything is being uploaded to the cloud. So information retrieval becomes much more easier. So human being is the only species in the animal kingdom that actually transmits this information across generations. And we have even went to such an extent that we have industrialized this. The name is education. Our children, they spend 12 to 14 years in school. What do they learn? Everything that human beings have accomplished so far, right? This is being taught to them over their school periods. Now, why is it that now we have this particular need for generating artificial intelligence? Now, in the last 3 decades, right from 1990 till now 2025, especially with the advent of internet and digital learning or digital era as such, there has been an explosion of information, right? Now what happens is, nowadays, with the amount of information that is available, we do not have a single human or a collection of humans cannot process all this information, convert it into knowledge and retrieve it. It's physically impossible, right? Which is why now there is a real need for generating a system that is capable of processing vast amounts of data which can be applied later. And thus the idea of artificial intelligence was born. Now we might think that artificial intelligence, it has been this hip hop term for the last 2-3 years, but in reality AI has been in the forefront of computing since 1956. That was when the term artificial intelligence was introduced. And now what happened was, that is just 10 years after ENIAC, the first computer was introduced, right? So since then, people have been thinking how to mimic the function of the human brain using computational systems. Now, when you talk about artificial intelligence, you come across these 3 terms. One is AI, which is, you can imagine, right from 1950s, there has been a lot of models. Initially, the models were actually, it's kind of like how we train a child. So certain children, their parents will tell them, you do not do this, you only do this. So there is a rigid framework around which their entire childhood is based upon. That's how we train certain children. But the downside of that is, those children, when they grow up, they kind of fail in the nuances of life, right? They are not exposed to enough nuances of human life scenarios that they fail in such tasks. This is the same analogy with artificial intelligence. So the earlier systems were actually designed, every processing need to be written down in code, and algorithm has to be fed to the system, so that whenever there is a scenario that comes outside this, the artificial intelligence of that era would fail. Which is why the research in AI had actually taken a dip from 1990s to 2000s. But then in 2000s, there was actually another area of AI which was brought to the forefront, known as deep learning. Now, machine learning, as the term suggests, it's obvious, it's the way by which you make machines learn. There are various algorithms to that. Because of a constraint of time, I'm not going into the details of that. But a subset of this machine learning is something known as deep learning. Now, deep learning is where you try to mimic the human thought process, how we process information, apply the same to a computational system, especially with lots of nodes. So we are talking about the human brain, so you can compare it with neurons. So certain neuron-like circuits which are arranged in certain layers, which are then flooded with data. Now there is no longer a need for a human to train an AI model from ground up, because the AI model is able to learn on its own. An example would be an AI model which can be flooded with images of cats. Earlier, we needed to train the model. Anything with a pointed nose, a stubby nose, the whiskers, that is a cat. Now a model can process all these millions of images and it will study the pattern. The pointy nose, the stubby nose, the whiskers, the beautiful eyes, everything is going to be something like that can be labeled potentially as a cat. That can be studied by the AI without any human. That is where we are standing right now. And there are certain other innovations in various fields that have culminated to this point. One is processor technology. Now, if you are following the stock market, especially the US stock market, you know how the NVIDIA stock prices had actually soared up in the past few years. NVIDIA is one of the leading manufacturers of processors. And with an increase in computing power, data analysis has become much more easier. Which is why data analysis as well as AI has taken a quantum leap over the first half of the 21st century. Now, I hope I have made this a point that AI is now capable of processing vast amounts of data in very short periods of time. So why am I telling all this? Is that, has it got some relevance in our field, medical education? Now, medical education, as you know, the curriculum itself is exhaustive. The amount of knowledge is too much, and the students usually get confused on how to employ an effective strategy in processing all this information. Not just that, there is a real need of a system-based feedback and assessment of whatever knowledge those students have assimilated. And even then, we need a decision support system. Those students who are going into the phase 3 or phase 4, their clinical postings, if we can provide a decision support system where they can make the connections, so and so symptoms, it can potentially be a diagnosis for this disease. And even then, once they pass out of MBBS and they move on to clinical practice, even there, AI can play a role where they can potentially be like the sir who is looking over their shoulders and trying to think whether their decisions are correct. So because medical field as such is generating such vast amounts of data, and we do not have 100% effective learning strategies for this data, AI has got a very big role to play here. So one of the most important implications of AI in medical education is something known as personalized learning platforms. Okay. Or you can call them as virtual tutors. Now, just last week or the week before last, I had a few students who approached me telling that they are finding studying cardiac cycle very difficult. Cardiac cycle is one of the most important topics in first year physiology. Now, the usual approach to education in medical field is a one-size-fits-all strategy. We have got a textbook, we have got resources, we have got a lecture, we'll deliver it. If we have 150 students, 10 students might pick it up completely, 20 might not, the rest will just falter away. Now, what happens is, using AI, you can actually create a model that can address the core learning issues of the students. For example, I can create a model with reasonable ease that can test the baseline knowledge of the student. Suppose a student is coming to me, I can deploy the model. The model will first give a quiz of whatever number of questions that I can tell it to provide the student. It will get an idea of the baseline knowledge of the student, which are the areas where the student is lacking, which are the areas where the student is strong. And then based on that, it can actually change the curriculum so that the student will get 100% returns on whatever time and effort that he is spending on learning. So personalized learning platform, this has also been introduced in a lot of learning platforms like Lecturio and even Ambos. They are using personalized learning platforms to improve the learning journey further. Now another area, so traditional learning is basically like taking a bus to somewhere, whereas AI based learning is going to be like self-driven car. Not pun intended there, I meant we are driving the car, we are making the stops, we are enjoying the scenery, and we are undertaking the learning journey. This can be supplemented with the use of artificial intelligence. Now another area where AI can actually excel is image based learning. So we have this radiologist, one sir, who was there in Jubilee Mission Medical College where I did my internship. He was very good in diagnosing any radiological data. How did he reach at that particular point? Because over his professional life, he had seen thousands of images of X-rays, CTs and MRIs based on which he can form a correct diagnosis out of any radiological data. So this is essentially the principle that we mentioned earlier, learning and application. Now with the improved computing power, we can now mimic this to such an extent that studies from some parts of the world has actually said, there was a study from UK where mammography findings were presented to an AI model as well as radiologists. The AI model had more precision than the radiologist. But then again, there was another study which compared the lung cancer findings in a CT and compared it across the radiologists as well as the AI. When the findings were a bit too vast and a bit too differentiated, AI had its troubles. In such cases, actually the radiologist actually took the cake for that. But then, when we go further into these nuances of AI, once the processing power reaches to such a high extent, even this can be overcome with the help of these models. So we have got various examples, QR.ai, ChecksNext. These are all platforms which engage in image recognition, and they can actually teach you how to recognize it. You can just imagine how your radiologist professors, how they taught you, right? They will actually show the X-ray, show the CT. These are the findings suggestive of this. The same thing can be taken by an AI model now. Even in pathology, iFora is an AI for image analysis. The same concepts apply. But the thing is, these models are a thing of the past. Today's general AIs, like the ones that many of you might be using in ChatGPT, they are smart enough to find the pathology in such X-rays. On the left, I have an X-ray which I procured from the internet. I just simply fed it to ChatGPT and I asked, where is the lesion? Outlined the lesion. It just put a red mark around the lesion and showed it to me. So it is that smart. This is basically a case of pneumonia, a simple case, but still the AI model was able to do it. But a few years back, it was not able to do it. A general purpose AI was not able to do it. So such is the innovation that is taking place in this field. Now, another very important area where AI can actually do real good is simulations. We already have the high fidelity mannequins available, but along with that, if you integrate an AI, now the current mannequins and the clinical decision making, they are fixed. We had to program what happens when the user does so and so. Instead of that, imagine a model which can actually change according to the user's decision. Suppose the user is giving a correct treatment, the patient can improve. Suppose the user is giving the wrong clinical decision, the patient can actually deteriorate, right? So AI makes it possible that physiological reasons can be considered. These can be converted into data points, and suppose a user is giving wrong instructions, there is a real visible deterioration of clinical condition. All these things can be applied into an AI model simulation. Again, some of the examples which are given there, MedVR and DaVinci, I think many of us are familiar with. It's a robotic surgery platform. So now they have got an AI training assistant known as DaVinci Sim now, which employs these principles. Now, based on this, with my rudimentary knowledge, I actually went up trying to create a history-taking model which would be useful for a first-year MBBS student. Actually, this is a screenshot from one of my projects at ACME. Advanced course of medical education, where me, Vinu sir and Dr. Vishnu, we were all colleagues there. So here we have something known as ECE, early clinical exposure for the phase 1 students. Now in whichever place I have worked at, ECE was more show than go, right? We cannot take all the 150 students to a patient, we cannot show them we cannot show the same patient to all the students. So it ultimately became a lecture as such. Now with AI, I can create a model. So I have created I think this is a iron deficiency anemia model. Now the model will not exclusively state that it has got iron deficiency anemia. The student can be made to talk with this AI. He can actually dig deeper, try to extract findings from its history that is suggestive of the diagnosis. So this can be an alternative to the traditional ECE models that we have employed. Actually, I have created 6 such models which can be used by the students to maybe hone their clinical history taking skills. But then, before we proceed further, working with AI really got me thinking. Now, what you see here, the container with all the pebbles, the container represents the knowledge base of an IMG, an Indian medical graduate, as NMC would like us to create. Now, fresh out of 12th standard, they are entering into a med school. They are having all this, this container which is supposed to be the repository of clinical knowledge. And we start filling it up, right? In first year, we have got physiology, biochemistry, anatomy. So each of the pebble represents a single subject. In second year, we fill it up with pathology, pharmacology, microbiology. Third year, we have forensic and community. And then we have got medicine, surgery, OBG, orthopedics, and the like. Now, what ends up having here? Each of these subjects is a rigid framework based on the faculties who take them, based on the rules and regulations. But they end up creating some gaps or voids. I would like to call them as knowledge gaps. Now, traditionally, we had a way of addressing these knowledge gaps, which was clinical cases. Someone 50 years ago who was doing their MBBS, when they are learning each of the subjects, they would be having more clinical exposure because the number of students are less, number of patients are more. they would be seeing multiple cases and they would be making the connections between these cases. A patient who is having MI has got a reduced ejection fraction because the stroke volume might be less. So they'll be making connection across multiple subjects, physiology, pathology, medicine, etc. But as time progressed, and when we undertook this journey of standardization of medical education, the clinical exposure has reduced. Which is why in today's students, they have got a lot of these knowledge gaps, and we cannot release such students into the wild as in the clinical practice wild. Because these knowledge gaps could be the difference between a patient being saved or the patient deteriorating. Now, simulation has tried to address these gaps to some extent, but with the help of AI, we can make such high fidelity simulations that would be very similar to a clinical scenario with all the nuances, and we can actually feed them to or make the student study them or make the student interact with them so that these gaps can be addressed. Which is why, reflecting on this thought, I had created a platform that, not really a platform, a prototypical platform as such, which integrates three concepts of education that I am personally interested in. One is simulation, the other one is AI, the third one is gamified learning. Now, I wanted to show this platform here. The platform is known as Code 10. So again, it was supposed to be in my laptop, so sadly I cannot do that. But if anyone is interested, I can really share the link with you and you can actually do it. If you share the QR code, it will take you straight to the page. So Code 10 is basically a ChatGPT platform that employs these three concepts: AI, simulation, and gamified learning. So as the name suggests, Code 10, you have got 10 decisions and you have a patient in front of you, one life. So for the time being, I have created a single emergency medicine case and I have beta tested with a few of my friends, cardiologists, emergency medicine, physicians, medicine, as well as some of the clinical year students. And what is important in AI, the decision support system. Because we as doctors, we are in the business of saving lives. So we need a real boost to the support of our decisions. So decision support, it has got a role to play in medical education, but not confined within the four walls of a medical college. Once the student passes out also, decision support systems are a must. Which is why AI in healthcare, many of these things you might have already heard of. In diagnostics, treatment and patient care, AI in healthcare has actually made really big strides. A few examples that you can actually see are Google DeepMind, which can actually scan the images of a retinal scan, and they can actually predict diabetic retinopathy. Or you can have stroke prediction algorithms. Recently, I saw a study which states that an AI model can actually go through multiple CT images. It can even predict a stroke 10 years in advance. 10 years in advance is too much, right? So that is another really big stride that AI has been making. Now, AI is also included in drug trials. In Silico Medicine is a company that specializes in doing drug trials using AI. Even before starting a randomized control trial, you can feed information to the patient regarding the genetic makeup of individuals, the possible drug allergies, and you can share the chemical formula of the drug and see or virtually see what are the possible complications that can arise. This is all before a randomized control trial. So again, AI is making big strides in such departments. As I said, AF or ECG, whoever has got an Apple Watch, it basically has got an AI system that can determine whether you have got an irregular rhythm. AF is one such diagnosis. And even back in India, many of these platforms, when we read about it, they are based out of other countries. But there is this interesting AI model that was created in India, a Bangalore-based startup known as August AI. It's basically a WhatsApp-based health assistant. It caters to a general population. Any doubts related to health, you can ask it, it will get cleared. But it was so accurate, so you can see the accuracy level compared to other large language models there. So it was so accurate that I have even used August to create some of the USMLE, PLAB or other questions, because the way in which it creates the questions were so clinically significant that it is hard not to give importance to the platform. So August is one of the homegrown AIs that is present, that is actually doing a really good job. It's actually a collaboration of machine learning experts and some doctors from Bangalore. And the list is endless. You can go through the names here, a lot of things. Today we had a session on mental health for medical students. Actually, there is an AI platform known as Wobot. So even I use ChatGPT for some of those difficult times. And from my experience, what I have seen is ChatGPT is much more understanding than a human, having a physical conversation with a human. But it might not always apply, but still, The more you engage with an AI model, the more it learns about you. You can see it from either side of the fence, but it does learn a lot of things. And to think that this is based upon a human brain working, that is really marvelous. So Wobot is one such application there, where someone having mental health troubles, they can actually converse with it, and it will try to provide its own set of guidelines and relief. So are we prepared? I know I have been rushing through a lot of things, but basically AI is taking over the healthcare landscape, and it is no longer a tool. AI is not just a distant pipe dream, it is a reality now. So are we equipped to handle it, or are we equipped to work with it? Because AI is not just a tool, it has started becoming a colleague. So how would you deal with your colleagues? You can deal with AI the same way you deal with your colleagues. You should be aware of your strengths, your limitations, your colleagues' limitations. Don't contest against your colleague. You can collaborate with your colleague. You can try to learn together. Actually, whatever, at least 80% of the information I learned about AI, I asked AI itself, how do you work, right? So, and if so that is something known as prompt engineering. If you design your sentences and questions in a really precise manner, AI can give you precise answers. So I can ask a ChatGPT platform that, okay, I want to make so and so platform. Can you describe it in 10 steps? I'm not someone from a technical background, I'm from a medical background, so it will simplify things. The only thing is you might have to validate certain concepts, but the bigger picture is it can actually teach you. And last but not the least, we have to keep the human touch alive, because medicine is not just a science, it's also an art. And the art part, it belongs with humans. Disclaimer, now we have studies that says that even AI can create better art than humans. But I wanted to keep it away, not to spook you guys, but still. So such is the level of intricacy that such models are actually operating with. What does it mean for our students? Now, our students, they really require a mindset shift. The thing is, our students are basically using ChatGPT. Last week also, I actually called a few students. We had given assignments to them. They typed the assignment question into ChatGPT. They copied the same answer, brought it to us, right? So it's not wrong to use ChatGPT, but it is wrong to use it in a wrongful manner, right? What I mean to say is, if they know how to ask ChatGPT regarding it, the funny thing is you can actually ask ChatGPT to write the assignment in a way that humans write, right? So it will take the machiney parts out of it, and it would simply look as if someone with natural language has written the assignment. But fortunately for us, our students are not that advanced, at least in my college. So the thing is, you should know, basically the model that I created for learning cardiac cycle, it can be done by a student itself. The only thing is the student should have clarity on what to get out of the AI model. Curriculum integration and interdisciplinary education, again, these steps need to come from a higher level, because I was actually having this conversation with Vinu sir today, that is, medicine has always been this bubble. We do not allow information from inside to disseminate to the outside much, and same is the other way around. We do not allow at least the things have been changing for the past couple of years, but then medicine is medicine, it comprises of all these sciences, and we are not too supportive of other areas or other technical areas coming and collaborating with the medical field. At least 50% of faculties are not. This resistance to change is already there. But the thing is, with the rate at which AI is progressing, if you do not have this interdisciplinary collaboration, we are going to lag behind. So both these things, along with the complete mindset shift, not just of the students, but also of faculty, is necessary if we are to collaborate with AI. So what is our role? Now, earlier we used to be content deliverers. We would be going through a text and we would be delivering it as lectures. And then CBME came along and we are now calling ourselves as facilitators. But with the advent of AI, we are going to become curators and validators. We are going to curate information, how that information is presented to the student. Not just that, we are making sure that this information is accurate. We are validating it. And we are creating multiple models of education that can be used for the student's benefit. So that is going to be our role going forward. But all is not sunshine and rainbows with AI. There are, of course, certain limitations as well as concerns. Concerns regarding accuracy. So IBM Watson is one of the largest patient data record AIs on existence today. Even that makes mistakes with the billions of dollars in funding. So accuracy is something that we need to keep in mind when we are talking about AI. That is where validation becomes important. Privacy. Many of the data that is being collected by certain AIs, many of you who are following this field might be knowing, the patient health records, there is no clear-cut mention about the informed consent that is being taken, because health records are a very sensitive records, right? So regarding privacy, there are various concerns, and even ethics. Who is getting accountable? An example from another field would be the Tesla self-driving cars, which actually uses AI. Some of them have gotten into an accident, people have lost their lives, and there is no clear-cut accountability either from the company or the government. So certain lines need to be drawn before using full-fledged AI for medical education. So then the big question, will AI replace medical educators? I'm sorry for the format there. Will it replace medical educators? Show of hands, how many of us think we will be replaced, will be obsolete by AI? It will not replace medical educators, but it will reshape us. But then again, there's a catch, not all of us. It will reshape only those people who are ready to reinvent themselves. Now come to think of it, AI is not at all about replacing us or replacing our jobs with AI models. It is going to change how we think, how we learn, how we teach. And we as medical educators should keep in mind that we are training the next generation of healthcare professionals. We are not just living in the now, serving the now, we are actually serving the future. So if you have got that idea, we should not be lagging behind when it comes to such technological advances. We should actually be leading forward. So with that being said, I'm finally winding up my session. Thank you so much for the patient listening, and thank you so much for having me here to present this.